Cloudphysician. That's an online-based technology and healthcare solutions provider. They've raised about $10.5 million in a fundraising round led by Peak 15 Partners. And joining in is Dr. Dhruv Joshi. He is the global CEO. Thanks so much for taking time out. And how you're looking to really expand with this latest fundraise. Congratulations, a marquee firm that is now supporting the company. Give us a sense as to how you're further looking to develop AI.
Hi, Avanne. It's a pleasure to be here. Thank you. We're very excited that Peak 15 Partners has led the new fundraise. They were supported by our existing investor, Elevar Equity, and we also had Panthera Peak, that was our venture debt partner in this round. It's going to be used towards three purposes. One is to further enhance our AI platform Radar, which is what enables doctors and nurses to take care of ICU patients wherever they may be located. Two is going to help us scale our operations across India. We are already in over 200 hospitals in a market that has over 50,000 hospitals. So we want to scale this business across India. And three is that we are the first mover in this space, and we want to now expand into international territories across the developing world, as well as markets like the United States. So that's what we're going to be focusing on in the coming months.
So in a sense, to basically understand, this is full stack AI and operations. So are you tying up with hospitals, with some of their departments? How exactly does it work?
That's right, Avanne. So I am a doctor, an ICU doctor myself, and I have worked both in India and in the US in hospital ICUs. And one of the problems that patients going into hospital ICUs have, unfortunately, is that either quality ICU care is not available or it is unaffordable. And so what we are doing is using technology. We are converting hospital ICUs into smart ICUs. We completely digitize the workflows. We put in high definition video cameras. We're able to use computer vision tools and analytics to analyze what's happening in these ICUs. And that enables super specialist doctors to be present at the bedside of these patients 24/7. Even if they are not physically present there all the time, you can have the ability of highly qualified doctors using this AI platform, helping manage patients. And we've taken care of over 1 lakh ICU patients across our network of hospitals and have been able to consistently show improving outcomes for patients, reducing mortality, more lives being saved by using this solution.
Sure, Dr. Joshi, given the fact that the Indian market itself has something like over 50,000 hospitals, how are you looking to capture a market share within that? How many ICU beds are you currently managing? Across how many cities are you working? How do you plan to expand that presence?
So we're in over 100 cities, covering about 2,500 ICU and emergency beds across over 200 hospitals, and yet we are barely scratching the surface. Uh, just in India, we've got over 50,000 hospitals that need a solution like this. And so in the coming months, we're looking to scale the solution where we are able to capture 10% of the market in India and expand internationally. Towards that, we're going to be investing in getting the best talent to join our team. And this includes all the way from talent in the business end of the spectrum to clinical talent to technology talent that's going to help us achieve what we are set out to do here. So the problem statement that we are solving, Avan, is a global problem statement. My co-founder, Dilip, and I have lived and worked in the United States for many years before moving to India to start Cloudphysician. And so we're very conscious of the problem that exists both here in India as well as the US. So the US is a market of interest for us, but even outside of that, other developing countries in Southeast Asia and the Middle East are the other international markets that are of interest to us in the coming months. Like I said, unfortunately, ICU care is either unaffordable or high quality care is not accessible. And this is the only way in which it can be provided. A solution like Cloudphysicians enables patients to get better care, lives to be saved. At the same time, it enables hospitals to improve, to run more efficiently, to manage more patients, and to increase their revenues as well.
So give us a sense as to what your financials stack up at, because as per numbers that we have, it's about 13 crores for FY23 in terms of revenues. What are the losses? Have they expanded or ballooned? When do you plan to break even?
So we increased our network of partner hospitals by 3x in the last year, and we're going to continue on that scale of accelerating our growth across. Like I said, we are barely scratching the surfaces. While I'm not going to talk about specific numbers right now, I can tell you that we're only looking to further accelerate because this is the need of the hour. Patients need better care, hospitals need to be run better, and a solution like ours is the only solution.
Sean, what's the long-term vision for Cloud Physician?
The long-term vision is to build a global organization that solves this problem at a global scale. What we're talking about is a universal problem, and what we're building at Cloud Physician is essentially a new way in which hospitals can run in a more efficient and a better manner, in a manner in which patients can get better care. And this is the way in which we're living in the 21st century that every hospital should operate. We should be able to provide high quality care to every patient that needs it. And Cloud Physician is hoping to become the organization that enables that to happen.